when we start talking about gastric ulcers, the really important thing to do is to recognise the terminology that we use in it and exactly what we're talking about. It's absolutely critical that we identify the difference. It's actually got to the point where it's really outdated to actually say my horse, if we talk about from a veterinary perspective, the horse has ulcers. It's not specific enough. It's not accurate enough. And so what we're talking about is the horse's stomach's this big chamber. It's sort of 12, 15 litres, depending on the size of the horse. And we have two regions to the stomach. The sort of the top third to half of the stomach is lined by a mucosa called the squamous mucosa. That lining is the same as our esophagus and the same as our skin. When we get into the bottom half of the stomach, we have the glandular mucosa. Now, importantly, they're two very different tissues, and effectively the glandular mucosa is like our stomach. What's relevant about that is I sort of consider them the odd couple. They happen to share the same accommodation, but they have nothing in common in so many ways. What's critical about that is what we know about squamous disease, we cannot directly extrapolate across and apply to glandular disease. And so when we're talking about the risk factors for disease, treatment for disease, prevention for disease, we have to be very specific as to whether we're talking about squamous or glandular disease, because there's actually very little crossover. When we look at the squamous mucosa, it's a nice, healthy, whitish, slightly yellowish coloured, that's the squamous mucosa. And as I said, that's sort of like our skin. And this area here is the start of the glandular mucosa. And the glandular mucosa extends all the way down into the pylorus, which is the emptying into the small intestine. We call this line between them this sort of imaginary line. It's a little bit like the equator. It's there, but not really there. The margo picatus, it's just a distinguishing point. The fundamental problem that squamous mucosa has is that it doesn't like acid and it lives next to an area that makes acid. All of our disease in squamous mucosa is primarily caused by acid exposure, and a variety of factors impact on that. And so what we see when we get acid exposure, we start to see thickening, which is this sort of first stage, what we call grade 1 lesions. And that's the same as if we walk around in bare feet, the heels of our feet will start to thicken, and that's the stomach just having exactly the same response. If we continue to insult or we exaggerate the insult, then we start to get specific lesions, and as we come across, we get very severe lesions. If we go to Google and we Google gastric ulcers in horses, virtually everything that comes up is about squamous disease. And we know a lot about squamous disease. But as I said, we have to recognise that that's different from glandular disease. So when we talk about glandular disease, we're in the bottom half of the stomach here. We're emptying into the small intestine. This is an area that normally lives bathed in very concentrated acid, a pH of 1 or 2, so extremely acidic environment, but it's got a strong protective mechanism. There's like a little mucoid slime that protects the glandular mucosa. Here's a nice healthy stomach, and then we come across to one that's got a little bit of inflammation. And then we start seeing small focal lesions, and we start seeing these bigger lesions. That sort of alludes to one of the really key distinctions between them is the populations that we see them in. So we'll talk about this more, but the squamous disease is associated with some primary dietary and exercise factors, and we see that in horses that do that. A really important early message and take-home message is we see glandular disease in a whole different population. We can see it in that population, but we see glandular disease in a population of horses that we would traditionally say are at low risk of ulcers. And they may well be at low risk of squamous ulcers because they don't have those risk factors, but they can still get glandular ulcers. And it's really come back to having to say that we're talking about squamous disease or glandular disease rather than this generic term of ulcers per se. If we want to reduce the risk of ulcers in our horse, we have to reduce the risk of two diseases, not one.